The show Disruptors. I'm your host, Aaron Hale, and this is Point of Impact. I've got a little riddle for you today. What's better than shoving a whole GNC into one syringe? If you're still guessing, keep listening because my guest today may have the answer for you. Are you suffering from a pesky injury that doesn't seem to heal? Or chronic pain from your joints or muscles? Neck, back, hips, knees, shoulders, head, shoulders, knees and toes, knees and toes. Cut me some slack. I've got kids. But your doctors, the only answer is either expensive medications that only mask the problem or invasive surgery. Neither truly get to the root cause of the problem, and both are very expensive. Dr. Jeff Donatello has another answer, a treatment that the drug companies and the insurance agencies aren't too keen on supporting because, regardless if it's in your best interest, it's really not in theirs. Dr. Jeff, he's taking processed amniotic fluid and injecting it right into the joints or the other injured areas, and with miraculous results. It's like taking a supercharged protein shake and injecting it right into the body where you need it. But it's also treating a end result. He's not stopping there. In fact, he's not even starting there. With his handful of wellness centers in New Hampshire and the Boston area of New England, he's getting to the cause. And most of the time, these injuries and joint pain, even so, it treats an end result, the symptom. But he's not stopping there. In fact, he's not even starting there. This treatment treats an end result, the symptom, and he's getting right at the cause. And for most of these injuries and illnesses and joint pain and everything else, the root causes are any one of or a combination of diet, stress, sleep, or fitness. So he's treating that first. Of course, this stem cell amniotic fluid treatment is incredible, and it's working wonders for quite a few people. We'll get to it in just a moment. A quick request: give the show 5 stars, leave a review, and share it with somebody. Share it on your networks or send it in a text to someone. You'll be making that small impact today. Without further ado, my conversation with Dr. Jeff Donatello. Dr. Jeff, welcome to the show. I've been excited about this interview for a while, and I can't wait to get into it. How are you doing?
I'm doing well. How are you, Aaron?
Doing great, doing great. I was talking about just before we start recording. I just jumped off the treadmill. At the time we're recording right now, I've got about a month to get ready for the Marine Corps Marathon. It's kind of a last minute decision, but I apologize if I'm sweating through my shirt.
I hate to tell you, I've done the Marine Corps Marathon, and I qualified for Boston, the Boston Marathon at the Marine Corps. And in all my events that I've done 100 triathlons, bunch of marathons. I didn't do my nutrition well, and I was running behind the guy who had the balloon for the Boston qualifier. He was right in front of me, so I had to stay with him to qualify for Boston. And my nutrition was off, and I started walking. And as soon as I walked, a Marine sergeant came onto the course and said, "There is no walking on my course." And I was like, and I kept running. So I always laugh about that one.
I love those guys. As soon as the starting gun goes, somebody yells, "Take the hill."
Uh,
It's so great. But speaking of the Boston Marathon, I've run it a couple times, and that's your stomping ground, isn't it? That's where you've set up business.
Yeah, if I get in the car, it's about an hour south. I'm on the coast of New Hampshire. We have offices in Massachusetts, and we have a couple offices in New Hampshire. We own Center for Wellbeing. We do a lot of regenerative medicine, stem cell therapy. My background is in chiropractic. I'm also functional medicine certified. I have a staff of about 30. And I'm kind of entrepreneurial now. So I kind of run the show along with my wife, Kelly. We're co directors. And, it's been a great thing to actually, have a staff and help more people because I'm not limited by just the number of people that I can help myself.
That's fascinating. I really do want to get into all of that, the entrepreneurial side. Really fascinated about stem cell and the possibilities there. Before we get into that, why don't you backfill? So on the story, where did you your family come from? What are the influences and events that forged
I
Dr.
have
Jeff Donatello?
I have an interesting backstory. I'm kind of a mutt, as most Americans are. My father was born in China to a Russian mother and an Italian father. They were kicked out by the communists in the 40s, and they went and lived in a bomb shelter post World War II in southern Italy. He had siblings that passed away of disease. And when he was 11, he came over here, was sponsored by an American family, and spoke Chinese, Russian, and Italian. But he was entrepreneurial. Um, and he was also my gym teacher. So he married my mom, whose father played for the Boston Red Sox. So what a mix, right? So so I have this mix of entrepreneurs and people that kind of just don't stop. That's how my dad is. He just his whole life he's just go forward, and yeah, you're gonna get hit, and to use the point of impact. We all have our different levels of impacts, right? Some are more severe than others, but we're all gonna get hit at different times. And if you're an entrepreneur, you have to just keep getting up and stepping up to bat, and knowing that you might hit one out of the park, but the goal in my mind is to hit a lot of singles and a lot of doubles and just stay
Mm-hmm.
that batting average over 300. And to use a baseball reference, does that make sense?
Absolutely. You don't want to swing for the fences every time. Uh, you're just going to strike out too often. But singles and doubles are what win the game, right?
Exactly. Exactly.
There's so much there to unpack. I mean, the Russian, Italian, and what was it? A grandfather that was a movie theaters in China.
Yeah, they're entrepreneurs. They owned a bunch of movie theaters, and the communists don't like people making money. And they came in, and overnight they said, "You're leaving right now." They packed up all their things, and he had an uncle that lived in southern Italy, in south of Rome, and they had a little bombed out house they lived in for 6 years. So growing up, um, we had to clean off our plates. Let's put it that way. We had to make sure that we ate all our food, and because he came from not a lot, and he's still alive. He's still doing great. They're 80 years old. They live in Florida, and it was a good background growing up, having your gym teacher as your father and first mother. Um, so I'm pretty fortunate that way in growing up in New Hampshire. It was not a bad way to live.
That's fantastic. I didn't realize that communists actually kicked anybody out. They just told them that you were going to work for them. Uh,
If you were entrepreneurial, they either killed you or said get out. That's what I was told. And my
hmm,
was not. I think I have some of his
our way or the highway, right?
yeah, and he was lots of his friends were killed, and he there was like if we don't leave, we will be killed. So they left.
So you're a chiropractor by trade, correct?
Yep, 20 years, retired 8 years ago to own the companies, not run, not work, and be limited in the company.
And how did you get into this stem cell arena from chiropractic work?
Yeah, great question. I was when the internet came around. The internet happened when I was just out of chiropractic school. I remember the day I was like, I could ask this little box any question, and it will answer any question I have. So I started getting on message boards, as did a lot of other doctors and chiropractors, and we were able to connect across the country. And I learned very quickly, and most people don't know this, California is about 2 years ahead with just about everything they do, and medical devices and medical biologics. They do things ahead of New England. We're very conservative in New England. So what I
Hmm.
find good people, good doctors that I knew that I trusted, and I copied what they did, and I was 2 years ahead in my market, and everybody caught up to me after that. So I thought that was a pretty good move, and I've done that over and over again in my career.
And tell me about tell me a little about stem cell therapy and what attracted you to it. Why is this such a growth market?
Yeah, it's because it works. And the regenerative biologic market is basically, they, from what I've heard, every 3 months we're learning double the amount of information. So it's taking off, right? What is limiting the knowledge that the country has is the fact that pharmaceutical companies and insurance companies don't support it. So it's out of pocket, and it costs a lot of money to go through these procedures.
Why not? Why isn't this? This is uh, it's almost I don't want to pigeonhole it, but it's almost like holistic
Oh, it
therapy. But not the astrological signs and rare Amazonian herbs. This is the real deal, right? This
it
is
is.
taking a natural product, human product, and healing, and it's actually having real effect, right? So why isn't this becoming mainstream? The therapy.
So let me go back. There's lots of different types of biologics. We use a purified amniotic fluid, which is taken from a healthy baby, healthy mom at
Hmm.
C births by FDA controlled labs, with cord banks that do this all day long in a very clean and controlled manner. So it's extremely safe. It's exactly what we put in you is exactly what nature has made. We use about 250 billion of these little bubbles that are inside of your amniotic fluid that is there to protect the baby from mom's disease, right?
Hmm.
Little bubbles called microvesicles, and what they do is they make your immune system turn on and off to help heal tissue. So if I put this in a degenerative joint, it's going to help heal cartilage. It'll make proteins, and it'll make your immune system start to heal. This works, Aaron, on a consistent basis. The most frustrating thing, though, is that the insurance companies. It's a natural substance, and insurance companies cover pharmaceuticals that are not natural because it's all about money. They have to basically have a patent on a product. So they'll take a natural substance, a pharmaceutical company, and they'll take a perfectly good natural substance and then they alter it chemically so they can call it their own, and then they market it. And when they alter it chemically, now it has side effects, but hopefully the side effects are less than the effects that the actual substance has. But in this situation, I can tell you right now with high certainty, if we were using this product on everybody in the country, the joint replacement industry would go out of business. The hospital drug industry, as far as pain, would pretty much go out of business. This works extremely effectively. The problem is, again, cost, because it's $4,000 a joint, and you know, it's $4,000 to bring your family to Disney World for 4 days. People find a way to do that, right? But we're not super health conscious in the United States, and the message really hasn't gotten out yet. So we're still in that early phase of making this a normalized thing. Does that make sense to you?
So they really have a vested interest in not letting this become more mainstream, more popular.
I think it doesn't fall into the way the world works right now. If you think for a second, during COVID, they were trying to do things, and this is embarrassing. This is fact. During COVID, what they were doing was not for your health. They were doing it to push a vaccine protocol, and there were many things that could help people during COVID that were pushed under the rug because there couldn't be another treatment for COVID, um, and get these drugs fast tracked. So
Hmm.
at that point we learned, well, I already knew, but it was solidified that our country, is our government is not out for health. It's backed by a money driven machine essentially, and these biologics don't fall into that paradigm, if that makes.
Yeah, yeah, it's a bit of a catch-22. We're the world's leader in producing medicines and treatments, and therapies for uh, most of the world's ailments, and we also have the most expensive medicine, drugs, insurance. So, and of course, there is a little bit of bias, a lot of bias actually, between the the government that's supposed to be our checks and balance against abuse in the system. Only the government, the insurance agencies, and medical providers. It's a like I said, it's a bit of a paradox, except it works when it works, and sometimes it doesn't. For these biologics, stem cells, this isn't the kind of same stem cell that say the scientists are growing whole organs from.
No, no, this is very different. We don't actually even use stem cells. These are biologics. This is what the stem cell secretes. So
Oh, okay.
stem cells in the United States that are multiplied and grown, you can't do that in the U.S. That's the one thing that we don't allow. Um, but that doesn't mean that what we use isn't just as good, if not better. So it's very, very confusing. The products that we use have been vetted out. There's doctors all over the country. There's probably 500 to 700 offices that utilize what I use. Um, and most of the NFL uses it now. I know that I have doctors that we distribute product to, that there's 5 NFL teams that a lot of the players use this product. So it works, and it's just it's taking time to get it out to the general public.
And this is extracted from live pregnant mothers that you said about 6 months in a pregnancy,
Oh, no, no,
and
no, no, not 6 months. No, that would kill the baby. Don't forget, you're taking all the fluid out. This is at birth. So a C,
oh,
yeah.
okay,
So to be
all
clear,
right, and then how many treatments can you get from one extraction? How many times can you extract from one person?
yeah,
What are the numbers on this?
yeah, great question. So what happens is a woman raises her hand and says, "I'm going to have a C-section." The cord bank times they show up at a certain time. The baby's born. The fluid is taken out. And to answer your question, it's 200 cc's on average, which is enough for 200 knees. So there's a lot. There's more fluid. There's more than we need. The problem is it now has to be put through third-party testing, very rigorous testing, the same testing that the FDA has mandated for blood for disease, to make sure that it's clean. And
Hmm.
then it goes back to the lab and it's manipulated in a way that the proper microvesicles and biologics are there. The proper proteins are in the mix. Then it's frozen, then it's shipped to doctors, and then you have to pay for the training, and then it's injected. But the process to do a knee is a real simple procedure. We can put them through an exam. If they have degeneration in a knee, hip, back, neck, shoulder, if they have degeneration or osteoarthritis or tissue that's not healing, they respond very, very quickly. So
Is
it's
this a living tissue? Is this something that needs to be refrigerated or kept at a certain temperature? Uh, what is it, or is it simply like a nutrient rich
a
fluid?
liquid. It's a fluid. There you go. Nutrient rich fluid. That's the best way to describe it. Even though they're not nutrients, like I said, there are 250 billion microvesicles in a clear fluid with specific proteins that are all aimed at healing. And our scientists, I've been with the same scientist for about 7 years now, Dr. Ian White. He's trained in stem cell therapy from Cornell and Harvard. And I've used his product over and over again. I've been to his lab, and we have about 30 doctors that I distribute to around the country that I train on how to use these products. And it's all about making sure that it's a clean lab with a doctor that's experienced, and the injector who is injecting you, whether it's we have a medical doctor that injects, and we have a nurse practitioner that they use guided imagery. Aaron, you want to make sure that they use ultrasound or a
Hmm.
CR to put this directly where the damage is. A lot of people go blind, they try to go cheap, and it's unfortunate because they
Hmm.
do it right. And we pride ourselves on doing it right, which is why we have people that most of our business flies in to see us. We market all over the country and the world. And I just had a guy from Virginia last night came in with his wife. We've had people from 7 countries. So So most of the people that are listening to this, they fly into Boston, and we're an hour north, and it's an easy thing. They get it done in a day, and then they go home the next day.
Okay, so you're not doing the injection yourself.
Nope.
Yeah.
Talk to nice people like you.
Okay. And okay, talk about the treatments. What does this uh, what does this serve? How what does this heal?
What is it? What is this? What does it help? Did you say?
Oh, what does it treat?
Yeah. So if you have an injury that has been around for 6 months and it's not healing, it's probably the C word, chronic, a chronic injury, and it's not going away. Your body's natural immune system has not done the job because the injury is more severe or your immune system is compromised. So if you have a tissue that's damaged, whether it's a tendon, a ligament, soft tissue, right, muscle,
Hmm.
that needs help. And if you're older, 45, 50, 55, 60, you heal slower, right? I'm 55 now. I don't heal as quickly. What it does is it takes your body's own natural healing mechanism and it supports it very quickly. So the best thing, if you're listening to this, if you're driving in the car and you have a chronic knee, chronic hip, low back pain that's just chronic that hasn't gone away, those are the people that we find do very, very well, as long as they don't have metabolic issues. Meaning, Aaron, if they have a type 2 diabetes condition that's really not
Hmm.
in the best control and their blood sugar's high, that means they're inflamed, right? And there's chronic inflammation. If they're overweight, severely overweight, obese, that fat, belly fat, exudes inflammation. So we can measure that in the blood. So what we found is that the worse shape someone's in, the less results they get. If we put this
Hmm.
in professional athlete, it's like putting super high octane fuel into a race car. Pew, they take off and they do extremely well. If we put this into someone who's 400 pounds and their hemoglobin A1C, which is a marker of blood sugar, is 9, 10, 11, and it should be 4.8 to 5.3, they're inflamed. They're full of sugar in their blood. They don't heal. So it all depends on the health of the person.
No, it's like putting out fires on the Titanic. If you're not taking care of yourself in general, something like that doesn't seem like it'd be very useful, at least not in the long run. Uh, in fact, you was visiting your website, and you actually do go before just this treatment. You're trying to reach them before they need uh, the stem cell treatment, this biologic. You're treating and helping others with weight loss and chronic pain in other ways, right?
Yeah, so we're very proud about that. 80% of our business during COVID, everybody got sick and heavy, and the country got really heavy. And we started a metabolic weight loss
Hmm.
program. So what we do is we have nurse practitioners and functional medicine specialists that are able to do a deep dive into blood work that, again, the insurance companies are not going to pay for, and they can look at markers that their doctors just can't get them. That will show inflammation, will show signs of disease ahead of time before the bad guys show up, right? So the fire isn't burning, right? If you go back to the Titanic, which I love, the metaphor of the fires on the Titanic, I look at it like we went into the engine room and we went in and we smacked the captain in the head a couple times and woke him up and said, "Slow down, dude. Slow down. You're gonna hit an iceberg." And that's what we do with the body. We look before I've never used this metaphor. I like it. I'm going to use it a lot. We look before the icebergs hit because the blood work, we look at food sensitivities because if you're sensitive to dairy, soy, egg, whatever the proteins in those foods, if you have sensitivities to those foods, you will become inflamed. If you're inflamed, your immune system is going to be compromised and you're not going to be healthy. So we do a lot of metabolic testing. We do genetic testing to really get to the root cause of that person's problem. And here's what most people have never experienced, Aaron, because they don't get to talk to someone like me. We have people that come in our office all the time with severe joint pain, especially knee and hip, that are overweight, and they think from the weight, and it's actually from the inflammation from the fat. And this is I'm going to have a story
Hmm.
to prove it. We had a lady that was 310 pounds come in. She could barely walk. Her knees were so inflamed. And we put her on our weight loss program. The first week, she lost 10 pounds, which is normal, but she still had 300 pounds on her frame. And I saw her walking through the office almost normal. And I went up to her and I said, your knees, you couldn't even walk up these stairs last week. How are your knees? She started crying. She said, my knees are almost 100% better. So her knee pain was from the inflammatory process that was going on through her whole body, which was secondary to food. So the American diet, the standard American diet for many people, what they're eating is causing joint pain, chronic joint pain, and it's killing them from within. And we all
So
know
just beginning to right the ship, you can start feeling the difference in your joints.
in the first week, we see it in 3 days, people feel better. I would say if we asked, we have 10 health coaches and we meet a lot with them. I bet you if I was to ask them on the second visit, the average person's pain is down 50% throughout their whole body. So while they lose weight, the inflammation comes down quickly. Your body wants to heal. Your body wants to heal. It wants to be healthy. But again, we can't wait until we've smacked into that iceberg, right? And that's what people do because they'd rather go to Disney World and eat cotton candy in Disney World and have fun short term than invest in their health. Not everybody, but they usually wait until the fire's burning, right? And then they like, help me. And now, now the Titanic is sinking into the ocean.
I've got a couple questions about that in particular. Uh, One being, I was reading one of your articles on the website, centerforwell.com, right?
Yes.
And it was uh, get rid of that belly fat. Get rid of the belly fat, and it was like 30 to 60 days or something like that. And you know what? That's been my biggest, the biggest monkey on my back, and the monkeys around my waist. I'm an ultra runner. I'm pretty fit. I don't. I was just trying to figure out, what your answer was to this. Love these love handles. I still can't seem to get rid of, and of course, the answer is far more simple but not always easy. And I was checking off this list of things that you were doing, like guilty, guilty, yeah, sugar, late night eating, guilty, alcohol, guilty. Uh, but it's not. There's no secret to losing weight or losing that belly fat. What are some of the big things people can do to start looking and feeling a little bit better? Oh, and the very first thing I think you mentioned there was about sleep.
Let's start there because if you don't get regenerative sleep, your body is going to be in a fight or flight response. So, this is what we do we look at stress. We all know about stress, right? But there's three types of stress we have physical stress, we have chemical stress, we have emotional stress. If your body's in a fight or flight response throughout the day, then your cortisol level, your adrenal glands is gonna elevate your cortisol level, and your body's gonna look at that like it's scared. And we have a really smart natural system in our body where it's an amazing system that's evolved over 2 million years to keep us from dying. So if it's in a stressed response, it's going to basically say, I don't know when my next meal is coming. Let's keep our fat reserves on because that's the best way to store fat. That's the best way to store calories is in fat. And what better way for men to store calories in the form of fat than above their hips? Because as we evolved over 80,000 generations, the man had to go and hunt and he would walk 7 to 10 miles a day. And what better way to carry that fat than above your hips? Think about that. Pretty amazing, right? So that's that's where for men the love handles come in, and women don't have the love handles, but men typically do because that's where we're going to be able to carry that fat better. So we definitely want to sleep. We can't sleep if we're inflamed. So food first. Food is everything. I think that we have this thing called the weight loss secret. It's one of our advertising marketing things. And there is a secret for us. Our secret is people lose 20 to 40 pounds. 98% of our people lose 20 to 40 pounds in 90 days because we keep insulin stable. Because of the foods that we have them eat, we keep it very stable. And then our health coaches look at those physical, chemical, and emotional stressors. So I'll tell you a quick story about a a lady that didn't lose weight in the first 2 weeks. And when that happens, there's always something. One of those three things: either they're cheating or something's going on. So we talked to her and in depth, and we said, what's your social life like? And she looked down at the ground and she's like, I don't want to talk about it. And what do you mean? And so the health coach told me this. She said, I got divorced from my husband 2 years ago, and he won't leave the second floor of our house, and I can't afford to leave the first floor of our house. So that guy still lives with me. He brings women home. He's a drug addict. He's a philanderer, and I'm stuck in the house. So we had some people intervene, and they got her to move in with someone else. And when she moved out of that house, her cortisol stress response dropped, and the lady dropped like 10 pounds the following week.
Wow.
So emotional stress, right? So if you've just gone through a divorce, or your kids having problems, or your boss is a jerk, or whatever that is, that's important. It's as important, as if you have gluten or dairy sensitivities and you don't know about it. So we have to look at the whole picture, like holistic medicine, holism, the whole thing. It's not just about eating. Anybody can starve themselves and lose weight, but we want to do it in a way that is healthy, and that promotes fat loss quickly, and that they learn something so that they don't continue to go back and yo-yo.
We all want that magic pill or the quick surgery that'll fix everything, but it, even though it might not be easy, the answer is far more simple. We just got to take care of our bodies. We got to get the right rest, and like you said, we got to reduce that stress in our lives. However, these therapeutics, the biologics that you're utilizing, uh, they are, in a sense, kind of a magic pill. Who passes the wellness test, and what kind of things? What kind of test is it to get in and get this treatment?
Yeah, so basically, if somebody comes in and they're super inflamed, we would know it fairly quickly. They're going to be on a couple medications. They're going to have diagnoses. They're going to have comorbidities. Really, we learned this word during COVID, right? I mean, medical people learned what comorbidities were, and those are other diseases that suppress your immunity. So really, a simple history. The average person's not going to have to go through a metabolic reset program before using stem cell therapy or the biologic. They're not going to have to. It's just people that have severe problems. They would do well to clean up their metabolism first, and that's just ruling out. We want people to succeed, right? So that's why we have consults. Usually with Zoom, people will talk to our practitioners, whether they're talking to our doctor or our nurse practitioner via Zoom, and get a good idea of if they are a candidate or not.
I do have a bit of a selfish reason for asking this because I, after running marathons and ultra marathons for about a decade now, as a blind man, the way I do so is with a sighted guide. And I'll run side by side with them, and we use a tether. I'll hold one end of a tether and just a short strip of something, and my guide runs shoulder to shoulder with me, and we run side by side. And what has happened is, because we don't have a natural arm swing, and I favor the one ear with the side with the working ear, the cochlear implant. I've been running for almost 10 years with my left arm in a 90-degree angle. Very unnatural. And what's happened is I've developed knots around my neck and shoulder, and even almost like arthritic joint pain in my like shoulder joint. Is that something? Is that a candidate? Is that something that this therapy might help with?
Yeah. So the first thing I think of is, have you seen a chiropractor? Have you seen a massage therapist regularly over this time?
I have seen a chiropractor, and it definitely helps with getting my back aligned. I also do yoga, and both of those help with the knots around my shoulder blade. Except the joint pain, it's more like an arthritic joint.
Yeah.
Uh,
You're,
it's more localized pain than the knots.
yeah, you're most definitely a candidate. You have degenerative change, you have arthritis, and arthritis is inflammatory, which when we inject this product into you, it goes right after. It's a calling signal, it's a beacon for these microvesicles to heal. So that's what we're looking for. We're looking for somebody that is metabolically healthy, that can go out and run, 50K, 100K. Have you done a 100 miler?
I just ran in July. I ran the Badwater 135, and I've run 300 milers before then.
So good for you. That was my world. I used to own a half Ironman triathlon, and I owned a race called Sea to Summit, which was a Ironman distance in New Hampshire.
Yeah.
So that was my world. I've done 100 plus triathlons, and the average person doesn't know what Badwater 135 is, but you are a badass to do Badwater. I've been there, I've seen it, and it's no joke. So your cardiovascular system is world class, but your body's asymmetry is below class. If there's a word for that, is so far. Um, how old are you now?
It's funny. I discovered. I knew this all along. I knew that natural arm swing and posture were the key, but there's like I couldn't figure out a way to run without the guidance the way I had it until until Badwater, where we couldn't run side by side. We had to go single file the whole way. And it's actually a pretty incredible thing. I was terrified leading up to the race about having such terrible arm, shoulder, and neck pain, which would probably rival the pain created on the course. Because over the years it's gotten worse and worse. Uh, and even switching from one side to the other doesn't seem to help any longer. It just makes both sides painful
How old are you now? How,
until we figured out a method for running one after the other.
how old are you now, Aaron?
I'm sorry.
How old are you?
45 in December.
Yeah. So after the age of 42, 3, 4, 5, degeneration advances very quickly, and arthritis will start to settle in. So it's your body's way of saying, "Don't do this anymore, dummy. Stop." Right. So you would definitely be a candidate for what we do. Where do you live, anyways? Where are you located?
I'm in the Panhandle, Florida.
Oh, you're not far. Okay. So yeah, we have, like I said, people fly into Boston all the time. We're ideally looking for somebody who is inflamed from arthritis. That's what I want to see. Arthritis, inflammation.
So maybe you're talking about maybe somebody inflamed from arthritis, maybe due just age. What about say the elderly?
Yeah,
You know, yeah, in the hands for many, that's a crippling uh, ailment.
yeah,
Is this something that could help there?
yeah. I mean, you got to differentiate it from rheumatoid arthritis, right? If it's osteoarthritis, we've had many hands we've worked on, but rheumatoid is a pro-inflammatory arthropathy. Um,
Hmm.
is a disease-based thing that's not going to respond to what we do. So that's where the exam would come in. So ideally, yeah, I mean, aging, tight joints, arthritic necks, backs, whatever, wherever there's arthritis, if they had enough of these biologics, they wouldn't have pain, and they wouldn't have arthritis. But the aging process slows things down, and we just age. We just don't go on forever, and arthritis is a sign of that in damaged joints.
Okay, so what's the treatment process? On average, what does it cost? Are there multiple treatments? Is this an ongoing thing? How does it work?
90% of our people are one and done. What you would do is you would come in and we determine usually over the phone a rough idea of what we're going to do and get a cost involved. For one joint, it's 4,600. For two joints, it's 8,600. For three, it goes up to 11,600. We have financing options for that. Um, but it's something that we don't want to take you on as a patient if you aren't going to get good results. So we're at a point now where, um, you know, we're a good 90% of our people are 80% better within 6 to 8 weeks.
Is this something that lays them up, or they go right back into normal activity?
Right back in, right back into the. So our NFL athletes, they love it because the new products that we have, you can inject and they can get back on the field. The old biologics were cellular. It was from Wharton's jelly, which comes from the umbilical cord, and
Hmm.
still people still use them, but I don't like them as much because they cause inflammation. In the same way that PRP, platelet-rich plasma, will cause inflammation before the healing occurs. So there's downtime. With our purified amniotic fluid product, we don't see downtime. We want you back in the game, and don't beat yourself up, but get back in and start doing what you need to do.
It sounds too good to be true. Uh, are there any adverse side effects? Is there a downside to this?
That's my big thing because it does sound like it's too good to be true, and the reality is it doesn't help everybody all the time. The biggest side effect is nothing can happen and you've wasted all your money. I love telling people that. Anyone that guarantees anything in the medical world needs to be put down. All right, run far from them. It's not the way the world works. But if what we did didn't work the majority of the time, we wouldn't be 2,000 patients in. They would have ran me out of town with a pitchfork like they did to Shrek in the movie. The downside really is, this is what I would tell people: if you decide to get this done, know your lab, know where the product's coming from, because there are doctors now that are making this product in their garage. I know one in Florida that's actually doing that. He set up a lab in his garage, and he's been one step ahead of the FDA for a long time. And he does a very cheap, inexpensive product, and there's a huge money grab. There's a lot of poor players in the regenerative world. So if you have a dirty needle with any procedure, you can infect somebody, right? So make sure that they use good needles. That's obviously number one. Make sure that you have a doctor or a nurse practitioner that uses guidance, ultrasound, or a C-arm. They know where they're injecting it, and make sure that they've done a lot and they've actually been through the ringer with this. They've done a lot of work, and they're not just like fly by night.
So are these this where these treatments are that you're serving? They're not your, or there's your clinics,
Yeah.
and you're serving other doctors and nurse practitioners, correct?
So I have three clinics. We do it. We also outsource our tough patients to a pain clinic. We have an MD now that works out of his office. Um, he takes our patients and he uses his high tech equipment to get more accurate injections. Um, but yeah, I also have doctors around the country. Not to confuse you, that I distribute product and help guide them through the process. So there's a lot going on, and it's all good. There's a lot of positiveness happening.
Well, sounds fantastic. Is there anything else you want to share about the therapy, about the wellness center? Anything we missed?
Yeah, I mean, if you go to Center for Well, if I could do some shameless promotion, if you do hear this, centerforwell.com. We're an hour north of Boston, and we have a good group of people that we work with, and we try to vet out the best of the best, and we train them, and it's we take it seriously because this is people's lives. And what would you do if you didn't have running, right? Think about that. And your body is telling you right now, Aaron, do something differently. And the number one sign of insanity, as you know, is doing the same thing over and over again and expecting different results. So sooner or later, that right arm that is going to be at a 90-degree angle, your scapula is going to say, I'm done, and muscle tissue is going to tear, and now you can't brush your teeth with that arm, never mind run. So it's, again, going back to your Titanic metaphor. It's waking the captain up before he hits the iceberg.
Uh, I'm picking different races. If it's changing. Uh, so if somebody's seeking out the therapy or wants to lose some weight, reduce the joint inflammation, or for medical practitioners that are interested in maybe getting supplies and training from you, they can. Everybody can go to centerforwell.com.
Oh yeah, yeah. And they can email me. I'm an open book. Um,
Awesome.
Anybody who wants to talk, we can talk for sure.
Terrific. Well, Doctor, thank you so much for coming on. I really appreciate this, and I hope we can get the word out. quite a bit more because it sounds like this is an incredible treatment. All right, doctor, if you had to pick one time in your life or a moment that was a pivot point for you, what would your point of impact be?
You know, we spoke a little bit before about how you had a major one, right? That's obvious, like a big bang, whatever it was. And I think the average person gets hit every day with micro traumas, right? And I've had them. I mean, I've had, physical ailments. Been through a divorce, but I've been very fortunate not to have any major impacts that way that weren't where I couldn't get up and dust myself off, right? And I think that it's a sign of having a high level of integrity and just don't back down. Um, when you are hit with an impact, what do? You don't quit. I mean, what do you got to do? Curl up in a ball, right? No, you just find a way around it. And if you lose your ears, you get a cochlear implant, right? And if you can't run, you find something else to do, a different type of race. So this is what it comes down to, Aaron. I always like to say, I try to be like the Chinese say, be like water. Water always finds a way through something or around something or over something or under it. It always finds a way around it. So there's always a way. God, the universe, they're going to give you challenges. But I think that it's everyone's job to figure your shit out, excuse my French, and keep moving forward and just don't stop. That's the whole thing. Just don't stop. Every day is a blessing. And man, you should go to bed happy that what you did during that day was awesome and get up the next day and do it again.
And like you said, be like water. And with time, water cuts right through. A great answer. I really appreciate it. Thank you very much.
I appreciate for the opportunity. Thank you so much.
All right, take care.